Hello and welcome to all of you here on the African continent and around the world. This is Let's Talk About Health in Africa on Utano podcast with me, Lenias Hwenda. Today, I'm joined by my colleague, Chris Kosivi, and we are going to talk to my guest, Dr. Philippe No, who leads the R&D department for neglected tropical diseases at the Sanofi Foundation. On January 30, we celebrated World Neglected Tropical Disease Day to raise awareness of the urgent need to combat, to control, and to eliminate these infectious diseases, which disproportionately affect the most vulnerable communities on the African continent. Imagine a disease that affects 60 million people and for which there are only 3 treatment choices. One of those treatment options kills 5% of the patients who take it because it is so toxic. It is also difficult to administer, and the treatment can only be given in a hospital setting. Patients with this disease are in desperate need for better treatment choices that are less toxic and easier to administer and do not require hospitalization for patients to get them. Philippe's team have just received a positive opinion from the Committee for Medicinal Products for Human Use of the European Medicines Agency, the European Medicines Regulator, for a medication called fexinidazole, which does all of those things. Fexinidazole treats a specific type of sleeping sickness caused by the parasite Trypanosoma brucei rhodesiense. On the African continent, Togo and Ivory Coast have already been declared free of sleeping sickness. Improved treatment options like this one, available at Sanofi, might enable other African countries to eradicate sleeping sickness and expedite the process. How is this treatment different from the few that already exist? And what do African communities and governments and other buyers of medicines need to know about this new treatment? Dr. Philippe No is here to answer all of these questions for us. Philippe, it's my pleasure to have you back on Let's Talk About Health in Africa on Utano podcast.
Thank you, Lenias. It's a pleasure to be back again and to talk to you again about sleeping sickness and all the progresses we are doing.
Wonderful. And I imagine you've made a lot of progress. So now, please start by reminding us briefly what sleeping sickness is and how many people are affected and where.
Yeah, so human African trypanosomiasis, which is the other name of sleeping sickness, is a life-threatening neglected tropical disease. It is considered endemic in 36 sub-Saharan African countries, where about 60 million people are estimated to be at some level of risk for sleeping sickness. Primarily those living in poor and remote rural areas where health infrastructure is poor or non-existent. Human African trypanosomiasis is transmitted to human by the bite of tsetse flies, and the agent, the parasite agent, is named Trypanosoma brucei, with 2 species of Trypanosoma brucei. One is named Gambiense, and another one is named Rhodesiense. The Gambiense is more in the western part of Africa, and the Rhodesiense is more in the eastern part of Africa, in the eastern part of Rift. So the Gambiense part is responsible for approximately 95% of all the cases, and the Rhodesiense is around 5%. Last year, in 2022, when I say last year, so in 2022, the last figures we have in terms of number of cases, which is provided by the WHO, we had altogether 877 patients after having tested 1.5 million people.
The impact, I imagine, on these communities must be quite significant. But now you have a treatment at Sanofi called fexinidazole, which recently received a positive opinion from the European Medicines Agency, and it's going to be used to treat acute sleeping sickness. What does getting a positive opinion mean, and what significance does the EMA positive opinion have on getting this treatment to patients?
So actually, until recently, few therapeutic options were available to treat sleeping sickness. The first available treatment was an arsenic-based drug with a lot of side effects, able to kill 1 to 20 patients. So then, at least for the Gambian form, the new options were developed recently, but all were injected IM or IV with long-term treatment duration, depending on the diagnostic stage, with lumbar puncture to identify the stage, and the treatment was mostly in hospital. Then these treatments in hospital far from the villages were requesting the patients to quit their family and feels putting in difficult situation the whole family group. For many years, being diagnosed with sleeping sickness was the worst thing that could happen for the patients.
Yeah.
But since 2018, Sanofi has been able to register for the first time a new full oral treatment to treat the Gambiense parasite of sleeping sickness named fexinazole. It treats most of the patients within 10 days oral treatment, and today 70% of the patients are treated with fexinazole. But until recently, the most severe cases of sleeping sickness, the Rhodesiense part, in the eastern part of Africa, was remaining with only the arsenic-based treatment. And this is where we obtained very recently, end of last year, in December, the positive opinion from EMA to treat these patients with fexinazole. This is a very good news, of course, for the patients. And now there will be the need for WHO to update their guidelines and then obtain full registration in Africa. And then we will have, when we have the updated guidelines and registration in Africa, we will be able to use fexinazole this year.
Yes, and you mentioned the early treatment being arsenic based and being the only treatment that was available for the patients, for the other 5% who are affected by Rhodiense. Give us an appreciation of how severe the side effects were with the old treatments, and maybe how fexinazole works. How do they compare? How does it improve on those bad side effects that used to be the case?
So when I talked to physicians who had administered the drug to the patients, the arsenic-based drug to the patient, it's the patient was describing like fire in the vein. Really, it was very, very painful treatment. And for the patients, for the physicians also, talking with them, it was always very frightening to administer this drug because you never knew what would happen with the drug. Because sometimes the patient would die. And imagine in a situation where the patients were coming, rather adult, healthy patient, diagnosed with the parasite, and then had to be administered with this drug. And sometimes the patient was just dying.
Wow.
And it was really, really frightening, really, very, very difficult path for both patients and also for the physician. And also the patient then were afraid to be diagnosed. So it was more and more difficult to test the people. Now with the treatment we have, with the oral treatment, easy to use and safe, it's completely changed, and hopefully it will help to go moving forward elimination of the disease.
That is a true game changer. I mean, I can't imagine what it must be like for a physician to be giving someone a medication that they know may well kill them. And I can understand the fear of the patients themselves of being diagnosed with this, because you just never know where you end up. Stay with us and we'll be right back. And when we come back, what is going to be the cost of this new medication, and what is Sanofi's access strategy to get it to the communities that need it? with all of that, the pain, the unpredictable side effects that you could see in the patients who got this treatment, why did it take so long, to get fexinidazole for this? Because you said it was already available for the Gambiense patients. Why is it being authorized to treat, the acute form of the illness only now?
Actually, it's very rare for as I mentioned, not more than 50 patients are diagnosed each year, and sometimes it works like in epidemic peak. And the clinical trial, which was conducted by our partner DNDi, an NGO, the name is Drug for Neglected Disease Initiative. This NGO was able to conduct the study in these very remote areas to find the patients, to go to chase the patients, to train the people in the country, and which is where conducting a clinical trial is not a given, and it's very complicated. You need to have a laboratory infrastructure. You need to have internet. You need to have many structure in place, and the idea was great to be able to do that and to collect 45 patients. So that means they were able to recruit in this study, which took 3 years to conduct the study, to collect all the data, and then Sanofi put them in a dossier, submit it to EMA, and then you have the time for the EMA to review with experts, etc., and so on. So that's why it was longer, because it was much more difficult to find the patients.
Yes, and I guess you had to go in very remote areas where the clinical trial infrastructure is not very well established. So I imagine that added to the difficulty of getting that patient group involved. Now, how is the availability going to impact the wider global efforts to eradicate sleeping sickness?
So as I mentioned, the Rhodesiense piece is only 10%, so 5 to 10%. So it's not the big the most important part, but altogether it's important to fight the disease, and to continue to test. Also to test the communities, and to have in front of the test the treatments. And today we have fexinazole, which is available. Fexinazole will continue to be donated to WHO and to the communities, to the countries, but we do not stop here. So we continue to develop, still in partnership with the DNDi. We are developing a new drug named acoziborole, and acoziborole is another oral drug, but instead of 10 days treatment, it will be just once treatment with 3 pills, and it will be over. And we already know the very good safety and efficacy profile of this drug, and we put a lot of hope on this.
Yeah, that sounds a lot better. Just a single treatment, and then you don't have to deal with issues of being able to track down patients and so forth. Now, in order to treat patients, you have to diagnose them first. And I know that this has always been one of the biggest challenges to addressing or to treating these neglected infections. How effective are the existing diagnostics for sleeping sickness, and how are they likely to impact the efforts to get this medication to more people, and also the efforts to eradicate sleeping sickness, even though it only accounts for 5 to 10%, but I imagine that's a part of the eradication effort. You still have to also reach the 5 to 10% affected by rhodesiense.
Yes. So you're right. Accurate and reliable diagnostic tools are an essential requirement. So that's for sure. And indeed, the standard for the Gambian case definition implies the demonstration of the parasite in any body fluid via microscopy. For
Yes.
Rhodesiense, to be honest, there is no test. We need to
Yes.
find directly the parasite in the blood or in the cerebral fluid. So up to now, there was the only way to administer drugs were to find parasites with microscope. Now we have some indirect signs of sleeping sickness with positive antibody response. And in this case, we could imagine using serosuspects, which are not all patients. Only few percent of these serosuspects are real true patients because of
Yes.
cross test. We could imagine with acoziborol, very good safety profile, very good efficacy profile, to test to treat these subjects also. So that
Yes.
would allow to clean the cases around one cases we find, for example, and then
Yes.
and this is providing a lot of hope in order to treat some potential reservoir of the parasite. But
Yes.
coming back to your question, the Rhodesiense parasite has a reservoir in animals. So that means that eradicating Rhodesiense case will not be possible. We can hope to stop transmission to humans. That means elimination is at reach, but eradication will be very difficult.
Okay, so with the preventing transmission, animal to human transmission, would that require perhaps sort of a prophylactic administration of this drug to keep people protected?
Prophylactic would be difficult because you cannot it's not like a vaccine, so you cannot protect for a long time the people. So it's the idea is more when you have a case in a village, for example, to treat all the proximate case in the village. So it would be like it would be more in this approach.
Sure. Okay, I get it. Now, what should countries be preparing for in order to take advantage of this treatment in their efforts to obviously to improve health in their communities?
Yeah, so I think what we must take into account is that sleeping sickness disease will be less and less frequent. So it will be less and less of fear. So it's important for countries to continue to have experts in sleeping sickness in the field, to continue to have dedicated organization to able to treat patients, to be able to recognize the parasite, to be able to have treatments available, and to continue to test, of course, is important because if we break the thermometer, we will not see what we do. So it's important to have to continue to do that, and my recommendation for the countries will be yes, please continue to monitor sleeping sickness. With the help of WHO, and Sanofi is donating $5 million per year to WHO in supporting the infrastructures, awareness, education, information for the countries, and donating the drugs, of course. But yes, we need to not because we do not stop to chase the disease, because we are in the last mile. And this is the most difficult part of to finish the job, I would say, of elimination.
Yes, no, very, very important to keep that expertise, especially with the animal reservoirs. It's something that always is going to be present in the environment.
Exactly.
Yes. Now, what can countries expect, the cost of getting this medication to be? Do you already have a price point, a price range, and what's your access strategy? How are you going to get this medication to countries?
So it will be the same as for since 2001, Sanofi is donating all the drugs for treating sleeping sickness. So we are doing it through WHO, and we are giving the drug to WHO. But WHO is working also with Médecins Sans Frontières, Doctors Without Borders, and we are sending all the drugs to Doctors Without Borders, not headquarters, but their stock, their drug
Yes.
stock, which is based in France.
Yes.
And when needed, the WHO is asking to the WHO to send the needed drugs to the endemic countries. And we will
Yes.
continue to do that. We are sending all the necessary drugs to Médecins Sans Frontières, and the WHO is requesting Médecins Sans Frontières to send it to the countries. So for the countries, no cost for the drug. They have to continue to have their infrastructure in place to be able to continue to test and to recognize the disease and to treat the disease.
Yes, yes. No, that's quite important, and a great thing, you know, that Sanofi is doing to continue to make that treatment available to these very vulnerable communities. Do you have any other final message you want to give about, you know, things that people and countries, governments needs to know about this treatment? Any final words?
If we succeed in elimination of the disease, it will be the first ever time we are able to eliminate a human fatal disease without a vaccine. So this is unbelievable. So we can do it. All together, we will need everyone on board. But this is an amazing hope. And I think we have the tools, we have the people, the expertise, the partners supporting it. And I think it's a lot of hope. But please do not stop to fight. And if we fight together, we will succeed in this elimination.
That's all for today. Philippe, thank you so much for coming on to Internal Podcast today.
You're very welcome. Thank you, Lenias.